And this is basically the concept of health insurance. Get a large group of people, most of them healthy at any one time, paying into a pool, and that's how you cover everybody's expenses. Now, if you know your history, you know that when we're talking about the late 1920s, early 1930s, we're going through the Great Depression, Franklin Roosevelt gets elected president. And we start talking about the New Deal and all these social programs to help sort of combat the widespread poverty and deprivation. And there's a lot of talk in the Roosevelt administration as they're forming their plans for what will eventually become the Social Security Act. There's a lot of talk about, well, maybe we shouldn't just make this a plan to give old people pensions when they retire. Maybe we should make this a plan that also gives people insurance to cover their medical expenses. Maybe we should make Social Security a national health insurance plan. And there's very serious consideration to give it that gets batted around his advisors. And eventually, depending on whose version of the history you believe, Roosevelt himself decides it's a bad idea. And it's not because he thinks it's a bad idea on the merits. He's totally in favor of it. He doesn't think he can make it happen politically. He's worried that if they attach medical insurance to the Social Security Act, the pushback from lobbying groups, particularly the insurance industry and particularly state medical societies, will be so intense that it'll kill the whole bill. And he doesn't want to risk losing the Social Security Act over health care. And so because of that decision, probably a correct decision politically, we don't get a national health insurance system at the moment when we're first starting to deal with modern healthcare costs. And that really would have been the end of the story if that were if the sort of suffering of people were probably the only reason that the healthcare costs were a problem. But it turns out that when people can't pay their healthcare bills, it's not just individuals who suffer. Remember we talked about hospitals building all these giant wings and all these doctors getting their education. Well, it's the early 1930s, and they're finding that because their patients can't pay the bills, they can't pay their bills either. They're starting to suffer. They need to do something about the cost crisis. And eventually, interestingly enough, in Dallas, Texas, Baylor Hospital, they hire a new administrator to try to figure out the finances. And it's a guy who used to be head of the superintendent of the Dallas Public Schools. And he's sitting there and he's coming in, and Baylor's like basically a month ahead of the sheriff's office on their bills. I mean, they are totally ready to default on everything. And he's looking at the account. He's like, God, we got to do something. We got to figure out some way to get some money into the system. And he says, you know, the teachers, he remembers the personnel records. He starts looking through them. And he said, you know, what if we went to the teachers and made them an offer and said, we're going to go to you guys. If you're willing to pay 50 cents a month, we'll give you up to 2 weeks of hospital care, whatever you need, for whatever you get. And they make this offer to the teachers. The teachers are very eager to take it up. And he figures out that as long as he can get 75% of the Dallas teachers to sign up for this, the math will work. The 80-20 rule will work out. They'll get enough people who are healthy to subsidize the cost of the unhealthy. And he does this. They sign up. And on Christmas Day, 1929, a teacher from the Dallas schools, she's walking around. She slips on some ice. She breaks her ankle. She gets taken to Baylor Hospital. They set her ankle. She goes to pay the bill. And they say, no, ma'am. You're all set. You're part of the hospital payment plan. You don't owe anything. She is the first American taken care of under modern, what we would consider health insurance. And the plan for Baylor works great. So great that other hospitals start copying it, first in Texas, then around the country. Eventually in Minneapolis, they have a hospital there. He starts a plan. He wants to advertise it. He's got kind of a knack for graphics and advertising, so he puts out posters advertising the plan, and they all have a Blue Cross on them. And that's how the Blue Cross system begins. And the Blue Cross system, to this day, is sort of the model for how health insurance will work in this country. And the early Blue Cross plans had a couple of distinguishing factors. One, like the Baylor plan, they focused on groups of employees. And that was very important. Again, the key to health insurance is getting that 80-20 mix. How do you get that 80-20 mix? The way you get that 80-20 mix is you find a random group of people. How do you find a random group of people out in society? Well, a large group of employees turns out to be a fairly random group of people. In this room, if we were to insure all of you, we'd probably get an 80-20 mix because, you know, you guys weren't selected because of your relative. You're young, so in that sense we wouldn't, but among, you know, people your age, you're probably a random group. There's probably a few of you who do have some big medical expenses and the rest of you don't. Well, employee groups work the same way, and that's how they started. But at the same time, these plans were run by the hospitals, and their primary goal was to get as many paying payment patients as possible. So once they got that good 80-20 mix, once they had a large number of people, they then they were willing to give insurance to anybody. They didn't have to, they would start just selling it one-on-one. So if you came to the Blue Cross plan and said, I want to buy insurance, they say, great, here's a plan, here's what it costs, you pay the bill, we'll give it to you. And so, sort of accidentally, sort of on purpose, sort of without really understanding the implications of it, these plans almost developed a kind of a social ethos about them. They were also nonprofit. And as they grew, state governments gave them special licenses and said, hey, we're going to let you operate this way, and we're going to let you be exempt from taxes because you're kind of fulfilling this important goal of providing insurance to people. And this system took off, and it grew, and eventually the sort of attachment of insurance to the job, it made so much sense that the government started encouraging it. One thing they did was they started saying, you know what? We're going to make it so that if you get health benefits from your employer, that doesn't count on your taxes. So suddenly $1 of health insurance actually becomes worth more than $1 of wages. And then during World War II, there were wage and price controls to basically, because there were the labor shortage because so many of the men were overseas fighting. But the government made a decision that health insurance benefits would be exempt from the wage and price controls. And so companies that were desperate to lure workers started loading up on the health benefits because this was an easy way to lure workers. And over time, the system everybody got used to it, and everyone found it very advantageous. Employers found it advantageous because, it was a good way to build worker loyalty. Unions found it advantageous because it gave them something to negotiate with, something they could deliver for their employees. And this system of tying insurance to employees and to employers, it really stuck. And the system grew. And actually, if I had a graph, oh wait, I forgot I do have a marker. I never get to do this. This is so much fun. Okay, so if I were going to graph insurance, enrollment, that's like doctor handwriting, insurance enrollment. And here's a 1930, 1940, 1950, and this is as a percentage of the population. You would see it's a nice straight line like this. And actually, if we go all the way out to 1960, 1970, it kind of goes like this. And over time, it's just steadily increasing. More and more workers are getting health insurance. And actually, this is a big reason. This slope here, this fact that it's going up, is a big reason that right here, Harry Truman, Dewey defeats Truman, not. Harry Truman proposes universal health insurance. He's going to follow through on Roosevelt's legacy. He's going to give the people national health insurance. And there's a big pushback against it. And one of the big arguments against it is we don't need national health insurance. We don't need to do that socializing European thing of, having the government do this because we got this great private sector nonprofit system going that's going to insure everybody. When, Truman loses and we don't get national health insurance in the late 1940s any more than we got it in the early 1930s. But this model starts to change. And one of the big changes that happens is that the commercial insurance industry starts to notice what's going on. Now, commercial insurers had actually tried health insurance during the 1920s. Basically, they would sell life insurance and they would offer people a rider. They'd say, hey, by the way, you're buying life insurance, do you want health insurance also? But they couldn't make it work because it turns out that in general, if you only sell to people individually, the only people who buy insurance are people who expect to need it. And so basically it was like in selling insurance to just the people with the yellow shirts, just the 20%. And it wasn't financially viable, so they gave it up. But as soon as they saw what Blue Cross was doing, and as soon as they saw that it was possible to make insurance work by selling to large groups, they got into the game. But they played it a little differently. First of all, they weren't nonprofits just out to make sure the hospitals had enough paying patients. They wanted to make a profit for themselves and for their shareholders. And so they did the math, and they said, you know what? It's true that in any random group you get the sort of statistically an 80-20 mix, but some random groups are going to be healthier than other groups. So younger people, for example, they're going to have lower health insurance bills, right? If you go to a workplace with lots of young men don't have children, right? They do, but they don't have to pay because, you guys know that. You're physicians. You know that anatomy. I I hope you know that anatomy. Men are cheap to insure. So what they would do is they would focus on groups of employees who they knew were cheaper to insure. And they were basically able to undersell the Blue Cross plans. Because remember, the Blue Cross plans were not just giving everybody insurance, they were selling it at one price. So a 28-year-old man was paying the same price as a 55-year-old man or a 35-year-old woman. And so if you were an insurer, a commercial insurer, you found those pockets where you had healthy groups and you could sell for less than the Blue Cross plan. You could steal away their customers. Ironically, back then, one of the groups that they started with were the auto workers. Big, strapping auto workers, very healthy. I mean, nobody wants to insure auto workers today, but in the 1940s, everybody wanted to insure auto workers. And so they did. And this drained away the healthier risks from the Blue Cross plans. In addition to that, unlike the Blue Cross plans, the commercial plans, they wouldn't sell to anybody individually because they knew from experience if they were selling individually, they were likely to get the bigger risk. So if you went to the insurance companies, if you went to a commercial insurer back in 1948, said, I want to buy insurance from you, they'd say, sure, we're happy to sell it to you. We just have a few questions. Have you ever been sick? Have you ever been in the hospital? Do you have a family history of this? Do you have a family history of that? Does your job present any risk? And on any number of factors, some of them serious, some of them not. You could be a cancer survivor, or maybe you just had a family history of heart disease, or maybe you just had allergies, whatever it was. They either would charge you higher rates, they would not cover anything related to your pre-existing conditions, or they would deny you coverage altogether. And so basically these insurers attracted the good risks and took them away from Blue Cross. The Blue Cross plans are left with a sicker and sicker populations. They have to keep raising their premiums because now they're, instead of an 80-20 mix of 80 healthy, 20 unhealthy, now they have like a 50-50 mix. And of course, the higher they raise their rates, the more the healthier people leave those plans and go to the commercial insurers, which are now that much cheaper. And the Blue Cross plans go through what's called the adverse selection death spiral. And eventually, most of these plans have to, one way or another, abandon the old model of what I would call the sort of social ethos of health insurance. And we get to the point where basically if you don't work for a large employer, you cannot get health insurance unless you are perfectly healthy. So that problem happens. And this is sort of churning along. Eventually in the 1960s, there's a sense that we need to do something about this. And partly that's because the most obvious group left out of workplace insurance is the elderly. Because they don't work anymore. And believe me, nobody wants to insure the elderly. Because the elderly are like walking medical risks. They're walking time bombs. My parents are like that. I love them dearly, but they're like walking medical time bombs. I mean, it's sort of a fact of life. It'll happen to me someday too. And eventually there's a groundswell because, the elderly are deserving in the sort of, in the political world. Everyone's going to get old. It's not anyone's fault they got old. And so there's this consensus that, yes, we're going to do something for them. And so we create Medicare to cover the elderly. And we, by the way, almost kind of quietly, without a lot of fanfare, they sort of snuck in, the people who wrote that law, they snuck in a second part called Medicaid to cover some of the poor. Now here it's only what we in this country traditionally define as the deserving poor, so it's women and children, but not, for example, able-bodied men. They're left out of the Medicaid formula. But, we do offer some insurance to some of the poor. And again, because of that, when you get to from Medicare and Medicaid, they pass in 65, 66. So by 1970, we've actually gotten to about 90% of the U.S. population has health insurance. And again, people who sort of say we should have universal health insurance, they say, whoa, shoot, we're almost there. And look at that graph. It's just going straight up. So you know what's going to happen now, right? Graphs that go up, they always go up. They keep going up. So we'll get to 100% right about here, and we'll thumb our nose at Sweden and all those European countries that had to do it through the government with all those taxes and that nasty stuff we don't like here. And that was the theory. Of course, there was another problem, it turns out. Now, the health insurance model of Blue Cross was very much done for the benefit of the hospitals. And so the system was hospital charges a bill, insurance pays a bill. Blue Shield, which grew up to then pay the doctors, same model. Doctor charges something, Blue Shield will pay it. No questions asked. Well, that model is great when health care expenses are 2% of GDP. But by now, they're up to like 10% of GDP. It's starting to get really expensive. And now you throw Medicare and Medicaid on the fire, and now we have this sort of explosion of costs. And some of the first people to really feel it are the employers, who are paying these bills, who were so excited to give their employees health insurance in the 30s and the 40s and the 50s and the 60s. Now comes the 70s and they're thinking, maybe this wasn't such a hot idea after all. I mean, they still like it. They still want to, they like to be able to offer this to their employees because it builds, it keeps the employees dependent on them or loyal to them.